All right. Welcome back. And today we're going to talk about bone fractures. And so, bone fractures are really just a break. So, despite the resilience of bone that we've talked about, how dense and strong it is, bones do break. And usually, if it's in our youth, most of these fractures occur as a result of like trauma. So, think about twisting or smashing, so sports injuries, or maybe even an accident or a fall, for example. And in the later years of life, the most common fractures occur as a result of some of our bones being a little bit more thinner and weaker. And so, first, we can see that the way that we can classify our bones are based on a number of different bone fractures, that is based on a number of different things. The first is whether it is the position, and that's kind of there at the bottom, the position of the bones after the fracture. So, a non displaced fracture is one in which the bone ends retain their position. If it's displaced, they're out of alignment, they're out of that normal alignment. The com- the orientation of the break can also be one, right? Like the orientation, whether it's a linear break that breaks parallel to the long axis of the bone, or transverse, whether it's perpendicular to the long axis of the bone, and whether the bone penetrates the skin or not. So if it's a simple fracture, it's one that breaks cleanly, does not penetrate the skin, and a compound fracture is one that uh, breaks protrudes through the skin and other tissues. There are a number of different types of fractures that we should be familiar with as it relates to the orientation, whether it's again closed or open, transverse. And here's a couple of ones that we should identify that. What's up with my mouse? We should be familiar with that include this comminuted fracture, so multiple fractures there, as well as a green stick fracture. So a green stick fracture is where the entire bone isn't necessarily fractured. What you have is a portion of the bone, and so we get that idea from, we get that concept from fractures that occur in our younger children. So they don't, the whole bone doesn't fracture, kind of splinters a little bit. And so when a bone breaks, ultimately blood flows from any vessel that is torn from the fracture. These vessels could be in the periosteum, the osteons, or even the medullary cavity itself. And then the bone begins to clot, right? At about 6 to 8 hours after the fracture, the clotting forms, and what you have is a fracture hematoma form. That's the first step. Within about 48 hours after the fracture, chondrocytes from the endosteum have created an internal callus by secreting a fibrocartilaginous material between the two ends of the bones that are broken, while the periosteal chondrocytes and osteoblasts create the external callus of the hyaline cartilage and bone. That is the second stage of fracture repair, the fracture of the internal and external callus being formed. The third step is occurs within a week when new bone trabecula begin to appear in the fibrocartilaginous callus and gradually convert to a bony callus of sponge. So the cartilaginous callus just becomes a more of a bone. It's replaced with bone. And then finally, the last stage of a fracture is remodeling, and remodeling just recurs throughout our lifetimes, which begins during that bony. It starts during the bony callus formation, and it'll continue on for several months while it's being remodeled. The final structure of remodel area resembles the original bone that was unbroken, and so you can see here on the list the stages of fracture repair. Now, hip fractures are a significant importance as it relates to our older individuals. So each year, over 300,000 older adults experience hip fractures. More than almost close to more than 90% of those fractures occur as a result of a fall, right? So in terms of like as a physical therapist or a movement specialist, right? Some of the keys to helping prevent falls is going to be key. So thinking about evaluating patients over the age of 65 for fall risks, reviewing their medications. There is a number of there's quite a bit of research to suggest that individuals that are on two or more medications are at a higher risk for falls. Again, vitamin D, as we've talked about, that supplementation and its importance for calcium transport in the GI system, getting screened for osteoporosis, doing balance exercises, right? Having your eyes checked is a component, and making the house safer are both components to reduce the risk of falls and ultimately reduce the risk of hip fractures here. You can see a couple of pictures here as it relates to a hip fracture. As you can see, as it relates to a hip fracture, the first is you can have what's referred to on the top as an intracapsular. So these are fractures that occur inside the capsule of the hip joint. So what essentially what would happen here is there's a hip replacement would occur here. So we scroll down here and you can see on the left side of the screen here, you can see that there's a new head that's being replaced there because it's in that bright shiny color that is being replaced. So a hip replacement would be the surgical procedure to address that. However, if it was extra capsular, you can see here how it breaks the bone, a lower distal to the head here. So what you get is an intramedullary rod oftentimes. So there's a rod that goes through the medullary cavity and as a result holds that head in place. So again, there's two types of fractures that can occur as it relates to hip fractures. Intracapsular that ends up inside usually occurs at the head of the femur, and the result is a hip replacement, right? They resurface the joint. Whereas if the case occurs distal to that head of the femur, if it happens extracapsular, what happens is that there's an intermedullary rod, a hip screw that is placed in that is responsible for holding it in place. That wraps up our section here on bone fractures and repair. Stay tuned. We'll have another one based on exercise, nutrition, and bone tissue.